A 60, a 60 years old man is brought to the emergency department by police officer because he was seen acting strangely in public. The patient was found talking nonsensically to the captors on cereal boxes in a grocery store. Past medical history is significant for multiple hospitalization for alcohol-related injuries and alcohol withdrawal seizures. Vital signs are within normal limits. On physical examination, the patient is disheveled and oriented times 1. Neurological examination shows horizontal nystagmus and severe ataxia is also noted. And after interviewing the patient, he forgets the face of persons and the questions asked shortly after he walks out the door. He, however, remembers events from his distant past quite well. Which of the following is the most likely diagnosis in this patient? A. Delirium. B. Delirium tremens. And C. Korsakoff amnesia. D. schizophrenia. E. Wernicke and encephalopathy. So the correct answer is C. This patient is most likely suffering from Korsakoff amnesia. His past medical history shows chronic issues with alcohol abuse, and his workup for other causes of confusion has been negative. This patient has nystagmus, confusion, ataxia, confabulation, grandiose fabrications, and amnesia. This is consistent with the Wernicke encephalopathy, which is treated with vitamin B1. Korsakoff's amnesia is usually present in patients who have recovered from Wernicke's. The amnesia in Korsakoff's amnesia is usually anterograde, not allowing patients to recall recent events but leaving past events intact. Option A, delirium, is a disorder of cognition and attention that must be distinguished between dementia and organic psychosis. Delirium typically has an acute onset of waxing and waning level of orientation and awareness. Delirium is also typically associated with visual hallucination. More importantly, the symptoms of delirium fluctuate throughout a 24-hour period. Option B, delirium tremens, DT, is a late finding associated with alcohol withdrawal, usually not seen until 3 to 5 days after cessation of alcohol. Typical signs of DT include severe autonomic hyperactivity, incontinence, marked confusion, and visual hallucinations. This patient has normal vital signs, and his physical examination findings are inconsistent with DT. Option D, schizophrenia is a chronic progressive psychosis due to hyperactivity of dopaminergic neurons in the brain. Patients are typically diagnosed in their 20s. Patients with schizophrenia typically present with auditory hallucinations, paranoia, disorganized thoughts, behavior, and a variety of other symptoms depending on the subtype of the disease. Option E, Wernicke's encephalopathy usually presents as a triad of ataxia, encephalopathy, and ophthalmoplegia. Lateral rectus or conjugate gaze palsy. This patient is most likely past the point of Wernicke encephalopathy, which would be confirmed by MRI, showing evidence of damage to the mammillary bodies. Learning objective. Korsakov's amnesia is seen in patients with a long history of alcohol abuse, particularly in those recovering from Wernicke's encephalopathy. It is characterized by anterograde amnesia and confabulation. Retrograde memory is usually preserved.